Welcome to Parent Squad. And like it or not, the cold temperatures are here to stay, at least for the next several months. But that doesn't mean that hunkering down and staying inside all winter. There is plenty of fun to be had outdoors. So here to help make us sure that the kids and parents stay safe is Franciscan Health Family Medicine Dr. Matthew Lash. Thank you for being here.
Thank you for having me. Yes.
Yeah. So first, let's run down the most common cold weather injuries. What happens?
So there's a couple of different cold injuries that obviously we want to talk about. Probably the first one is hypothermia. That's essentially where your body's temperature is low. So systemically, not just one area, the entire body temperature. So
and the body can't function past a certain point.
Exactly, yeah. Okay. So once it gets so low, you start getting tired and sleepy and other things like that. So there's varying degrees of it. So that's the first condition. The second one is frostbite. That's where like a specific body part, typically like the fingers, the tips of the nose or the ears, start getting not enough blood flow. Okay. So, and that again gradiates and kind of gets worse as well. So, first it starts, getting low blood flow, gets white, and then it starts, looking scary.
And then what's the difference between frostbite and frost nip?
Yeah, so frost nip, kind of like, a bite versus just a nip from an animal, right? Mm-hmm. The nip is, more, less severe. So I would say,
really?
Yeah. So it's less severe. So just a little bit of redness. Like typically it's when you see a kid with like a red nose or red ears.
Oh, okay. I think I've had that.
Yeah. I think we've all had that.
Yeah. So when you see these frostbite, frost nip, hypothermia, can you talk a little bit more about some of the symptoms so that people recognize it?
Yeah. So typically, for frostbite, you're going to see, discoloration of the skin, lack of sensation. You're essentially going to, it has no blood flow. So, you might see, darkening of the skin where it actually gets black. That would be, way more severe cases, probably more evident. For hypothermia, again, you're going to notice like things are slowing down, right? You're not thinking as quick.
Right.
And then in terms of like other things, right? Your reaction time won't be as quick. And then as stuff, slows down, you're going to get more tired.
And then there's some non-freezing cold injuries.
Yes. So non-freezing cold injuries. So I think of it like almost like a trench foot. So having wet and cold kind of mixed together in your foot can develop like other conditions that you can find on specifically the feet when it's like wet and cold.
Oh, okay.
Yeah.
So what should you do if, like for frost nip, you said you think most of us have probably seen that playing outside or something like that. If that does happen, how do you treat that? How do you reverse that? You bring the kids in. I feel like I remember my father telling me to move your fingers, get the blood flowing or something like that. What do you do? Yeah,
so, gentle rewarming, especially for frost nip. Again, that's, pretty benign, but obviously it can progress. So, when you're seeing that, gentle rewarming, avoid re-exposure to the cold is probably one of the big things. Warm fluids, warm liquids can help as well, more systemically. And then obviously moving that body part can help as well.
Okay, so, on the more serious note for frostbite and hypothermia, we probably need to be at a doctor for that.
Yes, so, by all means, come in and see us, but typically a lot of these injuries, especially severe hypothermia, or severe frostbite, those typically are treated in the emergency department because they can be so severe.
Because it's so severe.
Yeah.
Okay. So let's talk specifically now about the kids and the most common things that you end up seeing. Toddlers.
Yep.
Toddlers that are increased risk for this.
Yeah.
Obviously, I feel like language is a part of it, but what have you seen? What's your experience?
Fortunately, I haven't seen a lot of that, but because it can be severe. So, individuals that are like left in cars or left outside, they can get, very, very, very cold, very, very quick because they're smaller than us, right? We lose heat kind of through our body surface area. So they have a, larger body surface area to body mass. So they lose heat really quickly. So they, again, similar to us, they, shut down really quickly and, they don't think clear to begin with. So thinking a little less clear can be a little bit more difficult for them, right?
So, and you always coach your families that prevention starts with clothing. I know for cold weather, because I'm from a cold weather place too, they're always saying layer. Like, you gotta layer, layer, layer.
Exactly, yeah. So layering can help, but probably the biggest thing is supervision. So supervising your child is there's nothing that kind of works more than supervising your children. So layering can help, especially if they're inside. You put some layers on so they're not a toddler walking around in a diaper inside, and then they sneak outside, they're going to lose heat really quickly, compared to having a couple layers of clothes on. But,
I'm just thinking about the kids, especially when we were kids. You just go, 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 go. You're not really thinking that okay, there could be a bigger issue or something like that, especially if it's a snowball fight or something going on outside. Exactly. A good opportunity to take a break, maybe offer some water, maybe bring inside, warm up. You can go back outside and
hot cocoa, hot cider. Exactly. Checking on them regularly. If they're older kids, right, checking on them, making sure they're coming in, changing out gloves or wet layers. Anything that gets wet can, you just lose heat so much more quickly when it's wet. So,
Okay. And then locks and gates, obviously.
Yes.
Explain to me how all this works. So, since now my toddler is so mobile, I need to get special locks on the door so they can't just walk out the door.
Yeah, they're kind of at an overlap of like, they have enough capability, but not enough knowledge of kind of like what's going to happen.
Yes, I've seen that.
So they could open the doors, right? Not to add to people's anxiety, but like, especially yours, right?
My girlfriend said that, well, he wasn't a toddler. He was 5 years old at this point. He was down the street at the park playing by himself. And all the neighbors were calling like, hey, do you know your kid's out here? But I have another friend had a 2-year-old that got out the front door, just walked out the front door.
Yep, and it happens. So, using different tools and techniques. So whether that's gating the front door or using a lock, other things you can do are, if you have a sliding door and your toddler is like kind of able to open the sliding door. They make special locks for sliding doors that can kind of go on the window, way outside the toddler's reach. So which can, really help.
We have a sliding door. I need to look that up. Okay. So next is something that we all know can happen, but we're often not prepared. What are your recommendations for parents if in case the worst happens and you end up stranded with your kids in the car or the worst?
So again, similar to kind of all kind of cold weather prevention, layers, ensuring that you stay warm, right? Is probably the big one. The other one is how are you going to get help, right? Most of us have cell phones now and they can call somebody, a tow truck or somebody else to kind of get us out of a ditch or out of a place. But if for whatever reason you're kind of in that overlap of, stranded, but also you don't have communication, like making sure you're signaling, if you have road flares or other things.
So I know that we always talk about this on the news every year. I guess now I felt compelled to do it since I have a child, but prepping the car appropriately. So I think you were just talking about layers and making sure we're insulated and have on the proper things. I guess now it's time to put that blanket in the car, as we always advise people to do every year. Have that blanket in the car since the cold weather is coming. And then are you saying that we should stay inside to signal for help? Don't venture off, because that's the thing. We think, oh, we're good, but you never know. Now we have cell phones and many people live in urban areas where they can get help, but there might be a chance where that you might be in a situation where that's not the case.
So, stay in the car is probably the best bet because that's, it's a huge object. Typically they're darker. We're going to be able to see them unless you got a white car, right? They can protect you from the elements a little bit more. So at least that wind, that takes away a little bit of temperature. They talk about wind chill factor, right? So if there's no wind chill, right, you lose that component of like cooling, right, on your body. So, and you can also, periodically restart the car, as long as it's safe, you're making sure like the muffler or whatever is, outputting the exhaust isn't coming back into the car, right? So as long as those things are safe, regularly restarting that car can really help keep individuals warm as well. So.
And you reference active rewarming before. What exactly is active rewarming?
So active rewarming is using, whether that's warm fluids, warm liquids. Typically, like in emergency departments, they can use warmed IV fluids to kind of like ensure that they're, warming up.
From the inside.
From the inside. So that's active rewarming versus passive, which is where we kind of let your body rewarm itself, right?
Okay.
So we're using something like a hot water bottle.
Help it get there.
Exactly. So,
all right. And then nutrition and hydration, you just mentioned a water bottle, how that could play a role. Obviously, nutrition and making sure you're having the right food in.
Yeah. And, kind of going back to your kit discussion you had, having a kit with some like emergency food, emergency fluids, heat warmers, some blankets, warming layers that are kind of appropriate. I need to do this too. I kind of looked in my truck the other day and I didn't have, a sweater or a coat in the back of my truck. And I was like, the temperature had just plummeted. So, making sure you have that in case you need it, whether that's in a special compartment of the car or a special kit that you're, inspecting every year. Now would be a great time to do that.
Yeah, it would be. Look at me. Yeah, it would be. I'm trying to think like, oh, now I got to really make sure this happens.
Exactly.
Okay, let's talk a little bit more about the adults. We know the snow will come, and that means shoveling. This is a good reminder for us to know our limits. This is important because every year I feel like we do the story where we lose somebody in our community that was just out shoveling, just out taking care of whatever, outside. And you end up pushing yourself and you say, oh, it's a little exercise, but you may or may not be used to that. It can trigger cardiac events. Is this something that you see in your practice too?
Yeah. And it's very unfortunate when it happes, right? Because, typically they didn't have any preceding symptoms, but exercising by shoveling snow, it's a good exercise because it works a lot, but it's like doing lifting with a cardio exercise at the same time.
Okay.
So it's a lot of strain on the heart, and if your heart is not prepared for it because you haven't been conditioned and you don't normally exercise a lot and you go out and shovel snow, right, that it can kind of tip you over the edge.
So if you normally exercise a lot, then generally you would think it's safe. Because I think a lot of our seniors, they go out there and they are like, first of all, I'm going to do this myself because I'm not going to pay anybody extra money to take care of my house.
Yeah.
And it's kind of a sense of pride, know, and it just seems like they go a little too far. Is that what's happening?
Yeah, and you can do it in small bits, right? It doesn't all have to be done at once, right? So, doing smaller segments or just what you need to get your vehicle out, right? To safely get your vehicle out. I know, like, the snowplows come around and they might, accidentally replow in your driveway.
Yeah.
So, but not taking that component, maybe doing the rest of your driveway and then tackling those harder bits that are probably like slushy and heavier, full of, wet snow.
Yeah.
Right? It's a lot of energy to burn to do that.
Yeah.
So.
If you're lucky, you can stay inside and just wait for it to melt.
Exactly, yeah.
Okay, so if you do end up going out there, you decide to come back in, warm up first, avoiding heavy foods, alcohol.
Exactly, yep. So those things, they're already kind of putting some strain on you.
Yeah.
Your blood goes to different parts of your body when you're, when you're eating, the blood goes to your stomach to kind of feed you, so it's not going to other parts of your body. So you're kind of defeating the exercise that you're doing. When you drink alcohol, your body kind of vasodilates, you get a red face.
Yeah.
That's because the blood's going elsewhere, right? It's not going where it normally does. So exercising, especially with snow and lifting a bunch of snow and doing those things can definitely put you at risk.
Okay,
Yep.
and of course always changing out wet layers that
Oh, yeah.
can obviously make your body temperature drop. Dr. Lash, thank you for being here.
Yep, thank you for having me.
Yeah, for helping us with this. Certainly some good reminders, a reminder to myself. I should at the very least put a blanket in the car. I'm
Yeah.
gonna work on the emergency kit,
Yep.
but put a blanket in the car. We appreciate all your great advice and hopefully warmer days will be ahead soon. For more info, head to WTHR.com/Parent Squad. We have more ahead.